Let's see about Burkitt's lymphoma. So, Burkitt's lymphoma, also called as African jaw lymphoma. So, Burkitt's lymphoma, also called as African jaw lymphoma. So, Burkitt's lymphoma (BL), it is occurs endemically in parts of Africa. So, Burkitt's lymphoma also occurs sporadically throughout the world. So, it is an endemic tumor that's most commonly occur in the African region, and it is a high grade B cell neoplasm, and it has two major forms. One is endemic and another one is non-endemic form. The endemic form is also called as African form, and non-endemic form is also called as sporadic form. So Burkitt's lymphoma, it is most commonly occur in childhood tumor, but it is observed in adult patients also. It is the fastest growing malignancies in humans with a very high growth fraction. So it has high growth fraction. So what are the clinical features of African form Burkitt's lymphoma? It is mainly involved the maxilla and mandible, and involvement of the abdominal organs such as the kidneys, ovaries or retroperitoneal structures. It is less common. Most commonly it involves the maxilla and mandible. Less commonly it involves the abdominal organs. So this patient is a classical example of Burkitt's lymphoma, that is African form. It occurred or involving the maxilla and mandibular region. And sporadic form of Burkitt's lymphoma, it most commonly it involved the abdominal organs, and most common involvement of the distal ileum, cecum or mesentery, and less common involvement of other abdominal organs and pelvic organs and facial bones. So African form is most commonly occur in maxilla and mandible. So this picture showing the sporadic form of Burkitt's lymphoma that affect the abdominal organs. So the exact cause is not known, and Epstein-Barr virus, that is Epstein-Barr virus EBV, is closely associated with the African form of Burkitt's lymphoma, and immunosuppression caused by coexistent malaria or another infection, and host is unable to generate an adequate T lymphocyte response against B cells. So infected latent EBV. So that is Epstein-Barr virus is closely associated with the African form of Burkitt's lymphoma. Is very important. 90% of Burkitt's lymphoma translocation of the CMYC oncogene from chromosome 8 to either the immunoglobulin heavy chain region on chromosome, and 14T18 is to 14 or one of the light chain loci on chromosome 2, that is T18 8 is to 2. So these are the genetic causes. An African form of Burkitt's lymphoma has the patient present with swelling of the affected jaw or other facial bones, and have complaints of loosening of the teeth and swelling of the lymph nodes, and that is non-tender and rapidly growing in the neck or below the jaw, and abdominal presentation is also present, but it is less common. So we have to remember this point. In African form of Burkitt's lymphoma, patients have complaints in maxilla and mandible and other facial bones. And sporadic form of Burkitt's lymphoma, abdominal tumors causing swelling and pain in the affected area, and patient symptoms of bowel obstruction secondary to an ileocecal intersusception caused by tumor growth. So sporadic form of Burkitt's lymphoma mainly affecting the abdominal region. So it is a tumor, so it causing swelling and pain in the affected area. And the rapid growth of the Burkitt tumor, so patients may manifest significant metabolic derangement and renal function impairment. So less common presentations are epidural mass, skin nodules, and CNS symptoms and bone marrow involvement. These are the less common presentation. So Burkitt's lymphoma, it is a rapid growth tumor, fastest growing tumor. The rare case of Burkitt's lymphoma present as acute leukemia with fever, anemia, bleeding and adenopathy. It is a rare case of Burkitt's lymphoma. So acute leukemia with fever, anemia, bleeding and adenopathy. And major signs of Burkitt's lymphoma are soft tissue mass associated with the involvement of the jaw or other facial bones, and enlarged cervical lymph nodes and abdominal masses and ascites. These are the major signs of Burkitt's lymphoma. So there is a abdominal masses and ascites, and definitely the cervical lymph nodes are enlarged. And what are the histological features of Burkitt's lymphoma? It is a monoclonal proliferation of B lymphocytes, and there is a small non-cleaved cells that are uniform in appearance and that produce a diffuse pattern of tissue involvement. So in Burkitt's lymphoma, BB. So Burkitt's lymphoma, there is a proliferation of B lymphocytes. The Burkitt cells, it is a homogeneous in size and shape with round to oval nuclei and slightly coarse chromatin with multiple nucleoli with intensely basophilic vacuolated cytoplasm that contains neutral fat. Frequent mitotic figures are observed in Burkitt's cells. So this is Burkitt cell. The starry sky appearance. It is the special appearance present in the Burkitt's lymphoma cases. So scattered macrophages with an abundant clear cytoplasm containing phagocytic cellular debris. So this is the important point, starry sky appearance. So this picture showing the starry sky appearance of Burkitt's lymphoma. There is macrophages present. And what are the treatment and prognosis of this condition? So the treatment is combination chemotherapy and CNS prophylaxis. The survival rate is 60%. If bone marrow and CNS involvement is present, then it have poor prognosis. And the adult with disease and advanced stage is poor prognosis when compared to child. And staging of the Burkitt's lymphoma, it has 4 stages. The stage 1 is lymphoma is only in one group of lymph nodes in one particular area of the body. In stage 2, more than one group of lymph nodes is affected, but all the affected nodes are contained within either the upper half or lower half of the body. So stage 1 is one group of lymph node and stage 2 is more than one group of lymph nodes. In stage 1, one particular area of the body is affected. In stage 2, nodes are affected but either at upper half of the body or lower half of the body. In stage 3, lymphoma present in lymph nodes in both the upper and lower parts of the body. Spleen is considered as a lymph node in this staging system. In stage 4, lymphoma spread beyond the lymph nodes to other organs, to sites such as nervous system, bone marrow, liver or lungs. So stage 3, lymph node, both the lymph node present in the upper and lower half of the part are affected. The tumor can be stained with antibodies to lambda light chains, that is monoclonal tumor of B cell origin. 90% of cases cell express immunoglobulin M at cell surface. Lymphoma cells are CD20 plus, CD5 minus, CD10 plus and BCL minus 2 plus. These are the lymphoma cells present in this type of tumor. So the important points here we have to remember are Burkitt's lymphoma is also called as African jaw lymphoma. It has 2